Healthcare today is communicating disease pattern and data for workplace health management.
Occupational stress is a common issue among healthcare workers due to heavy workload, limited resources, poor working conditions, and workplace conflict. If not managed properly, it can lead to burnout, anxiety, depression, and reduced work performance. It also can affect healthcare organizations by increasing absenteeism and staff turnover. Therefore, this report examines the epidemiology of occupational stress, identify the high-risk group and workplace risk factor, and discuss the prevention, control, and treatment strategy.
This chart shows the prevalence of burnout among healthcare workers reported in different Malaysian studies. In 2022, 24.4% of MOH nurses reported burnout. In 2024, personnel burnout increased to 41.7% among healthcare providers in Selangor primary care clinics. The highest prevalence was reported in 2025, where 54.7% of healthcare professionals at Hospital Raja Permaisuri Bainun experienced moderate burnout. Overall, this finding shows that burnout continues to be a serious occupational health issue in the healthcare sector. This slide presents the trend analysis of burnout among healthcare workers in Malaysia. As shown in the line graph, burnout has increased over recent years. In 2022, a national survey among Ministry of Health nurses reported a 24.4% burnout prevalence. However, more recent studies conducted in Selangor and Perak found much higher levels, with 41.7% experiencing personal burnout and 54.7% experiencing moderate burnout. The chart shows that burnout has become more common, especially after the COVID-19 pandemic. Looking at the disease pattern, the overall trend indicates the burnout remains a persistent occupational health issue among Malaysian healthcare workers. Although different studies use different methods, they are reported consistently high burnout rates. Several factors may explain this increasing trend, including staff shortage, increasing patient demands, prolonged work-related stress, and the long-term impact of the COVID-19 pandemic. In conclusion, the finding shows that burnout continues to be a major challenge in Malaysia's healthcare system. This highlights the need for better workload management.
Healthcare workers are one of the occupational groups most at risk of stress and burnout because they are work in demanding and high-pressure environment. First, the physician experience high level of stress due to the heavy workload, long working hours, and the need to make critical medical decisions. Second, nurses are also at high risk because they provide continuous patient care while meeting both the physical and emotional needs of patients and their families. Lastly, paramedic or ambulance. They face unpredictable emergency situations such as accident and trauma cases where they must make quick decisions under pressure. Overall, these healthcare professionals are more likely to experience occupational stress and burnout due to their heavy responsibilities, emotional demands, and challenging work environment. Next is possible workplace risk factor. Healthcare workers face several workplace factors that can lead to stress and burnout. First, they often work in very stressful environment where they care for seriously ill patients and are regularly exposed to pain, suffering, and death. Second, they experience high workloads and long working hours, which can make their job more exhausting. Many healthcare workers also work shift cycle, including double shift and irregular on-call duties, which can disrupt their rest pattern. Because of this, they often have limited rest and recovery time, which lead to fatigue over time. In addition, the physical demand of the job, such as handling and moving patients, increase the risk of physical strain and injury. Prevention strategies are important to reduce occupational stress and burnout among health workers. This strategy focus on improving working conditions before stress becomes a health problem. One key approach is better workforce planning and scheduling. Shift length should be limited to about 8 to 10 hours, and forward shift rotation such as moving from day shift to evening shift should be practiced. This helps to reduce fatigue and sleep problem. It also important to ensure healthcare workers get enough rest time. Involving staff in creating work schedules can help match shift with their preference and natural body rhythm, which improve the comfort and performance. This improvement help reduce sleep debt, especially among high-risk groups like ICU nurse and frontliner workers. In addition, educational and support program can help prevent burnout. For example, sleep education program like Sleep Stop can improve sleep quality. Mindfulness-based stress reduction or MBSR also help healthcare workers manage stress and control their emotion in difficult situations.
Control strategies are secondary intervention used to monitor burnout and reduce the effect of psychosocial risk in the workplace. One important approach is improving organizational support and giving healthcare workers more control over their work. Leadership plays a key role here, especially through sleep leadership, where supervisors encourage healthy behavior such as getting enough rest and supporting staff well-being. Healthcare institutions can also appoint mental health champion or sleep trainer in each unit. These individuals provide guidance, resources, and act as role models for other staff. Another important strategy is regular monitoring. Psychosocial risk assessment and burnout screening should be conducted to track stress levels among healthcare workers. This helps in the early detection of issues such as emotional exhaustion and depersonalization. Tools like the Maslach Burnout Inventory or the Professional Quality of Life Scale can be used to measure burnout levels and evaluate the effectiveness of current intervention. Overall, these strategies help institutions improve workplace policies, reduce turnover, and build a more resilient healthcare workforce. Treatment strategies are tertiary intervention designed for healthcare workers who are already experiencing occupational stress or burnout. Common symptoms include anxiety, depression, sleep problems, and emotional exhaustion. One effective treatment is mindfulness-based stress reduction or MBSR. This program teaches healthcare workers to become more aware of their thoughts and emotions, helping them manage stress in a healthier way. Research shows that MBSR can reduce stress, anxiety, and depression among doctors and nurses. Even shorter programs lasting 4 to 7 weeks have been found to be effective. In addition to MBSR, healthcare workers should have access to professional counseling and occupational health service. This service provides psychological support, help manage compassion fatigue, and assist workers during the return to work process after recovering from stress or burnout. Healthcare organizations can also provide targeted coaching program and healthy habit training through employee assistance programs or EAP and on-site psychologists. Thank you for watching.